There are 3 different ways to check placement per NG tube. Check your agency's policies. I'm going to start by showing you how to check placement with an air bolus. I have my 60 ml syringe. I want to instill about 30 mLs of air. With my stethoscope, I'm going to be listening in the epigastric area. I want to pinch my tubing, remove my cap, and attach my syringe. I'm going to instill my air, listening for a whoosh. When I hear the whoosh, I know that the tip of the NG tube is in the stomach. I'm pinching my tubing now. I am replacing my cap. Now I will check the placement of the NG tube by checking the pH of the gastric contents. I will use a litmus strip to check the pH of the contents. Using my syringe, I'm going to clamp the NG tube, remove the cap, and withdraw 5 to 10 mLs of gastric contents. Then I will clamp the tube, replace the cap, and place a few drops of the gastric contents on the litmus paper. I want to see that the gastric pH is less than 5.5. I will then return the contents to the patient by clamping the NG tube, removing the cap, instilling the contents. Then I will flush the tube with water so that it will not clog off. While clamping the tube, I will pour approximately 30 mLs of water in the syringe and allow the water to instill by gravity. Once the water has instilled, I will flush the NG tube with 30 mLs of air to remove any fluid from the line, pinch the tube, and clamp it by putting a cap on the end. A third way to check the placement of your NG tube is once your NG tube is inserted, to have a measuring tape, measuring your tube in centimeters from the tip of the nose at the nair to the end of the clear part of the nasogastric tube. You want to take a measurement in centimeters. I have 74 centimeters. I would want to record that measurement. My patient would then go for a chest x-ray. I would want to secure my NG tube with a piece of tape and a safety pin. When my patient returns from x-ray, I want to measure the tube to make sure that it has not been displaced. And again, I get the same measurement. I will secure my tube. Before I can access or use my tube for medications or feedings, I need to have an order from a radiologist or a primary care provider stating that the x-ray shows that the tip of the NG tube is in the stomach. When you have a patient with a nasogastric tube, it is important that you do mouth care at least every 2 hours and that you do lip care as well, keep making sure that the patient can have some type of ointment on the lips to keep them moist, not Vaseline. Making sure that you can use a swab in the mouth to keep the mucous membranes moist, brushing the teeth, and using Kleenex or washcloth as well to keep the nose